I was stunned, or maybe even appalled, to hear earlier today that the new administration is going to do a set of calculus to tell households what it really costs for them to live where they choose to live. On the assumption, of course, that households are not able to figure this out for themselves, because we are all so stupid. But when I looked at these models, because this is not the first time this has been suggested, the assumption is that a household has only one person, and that that one person commutes into the central business district. So, and they work on this presumption, if you move this household closer to the CBD, they travel less. But if the household, for example, has 3 people, most of those trips they generate are not work-related. In fact, many of them are going out to the tennis court or to the beach or the massage parlor. Moving that household closer to the CBD actually increases the costs of travel. Now, it seems to me quite vital at this stage that somebody throws a spanner into that work. And I believe that maybe your organization is well placed to say, how are you going to include into your modeling the fact that most households actually have more than one person? Because I think it would totally stymie them.
Great point. You know, we really have to move beyond this transportation modeling where we focus everybody on the 20 to 24-year-old. Before they're married, they don't have kids or anything like that. That's a real problem. And again, what we're doing here is we're trying. What's different about our work is that we're not thinking about the way people should travel. We're looking at the way they actually travel, and we're trying to make our transportation system and network work based on what people actually do, as opposed to the way we think they should do. And that leads you to a very different place. It leads you to the 3-dimensional spider web. It leads you away from the hub and spoke wagon wheel. And it leads you to the automobile, because it gives you the point-to-point transportation mobility that no other mode of transportation can give you other than walking. Walking is also a way of auto-mobility, self-directed mobility. Most of us don't want to live in Manhattan. And in fact, in Seattle, we like to live in Seattle until we get married and have kids, and then we move out. Or at least not me personally, but that's what the demographics say. So that's the key. The transportation system has to be modeled on what we actually do, as opposed to the way we would like them, or someone would like us to travel.
Oh, we have more. Let's do 2 more questions. I'll let the 3 of you fight out who does the final 2, but let's just do 2 more.
Here in Washington, we have what we call the 18th Amendment, which protects the gas tax to be used on highways. And one concern that I have with the pricing and the tolling is that the pricing and tolling will not be protected. And so that money can be used for anything like transit or unemployment insurance or health care or whatever. So what's been the experience, and how do you anticipate the pricing pot of money to be allocated really to congestion relief?
Yeah. Great point. We are very strongly in favor of dedicating all of that money to transportation, preferably roads. It's different in different states, but it requires diligence on the part of citizens to be active in the process to ensure those safeguards are there, because they will erode immediately if you're not watching. It's a public choice problem. It's a public involvement and political problem. But if you allow that money to be siphoned into other areas, you're not going to get the benefits. You're not actually going to get the capacity improvements you need to actually address congestion. So really, what we're seeing in Atlanta and to a large extent in Texas is we're seeing that in order to make sure that revenue is tied to roads and transportation, there has to be an explicit goal of reducing congestion. Because that's when you get the revenue tied to the congestion-reducing investments. If you don't have that mobility goal explicit, the money is going to go to whatever somebody wants. And it's not just to an unproductive investment in transportation, it could be stopgap in the whatever expansion of the Medicaid program they make. Or it could go into K-12 education, higher education. So it has to be coupled with an explicit public policy goal to improve mobility, which means reducing congestion.
I don't think I heard you say anything tonight about mass transit, and I'm wondering where you think that fits into the equation.
Yeah. Great question. I'm surprised it took you this long to pick up on that. What about mass transit? You know, I'm a little bit torn on mass transit. Because, in fact, I believe that there are places where mass transit works. But unfortunately, and this is true in Seattle, actually, the true in Seattle is almost as common here, or is in, Seattle's not atypical compared to other metropolitan areas. The problem is it just doesn't carry enough people to make much of a difference. When we're looking at mobility on a regional level, when we're looking at ridership, when we're looking at congestion, you could double transit's ridership in Seattle, which would be, by the way, an unprecedented improvement in the competitiveness of transit anywhere in the United States if you could do that. But it's not going to make any difference. It simply doesn't carry the numbers to reduce congestion in a meaningful way.
But if you look at the major cities in the world, Paris, London, New York, Washington, D.C., mass transit is at capacity most of the time, isn't it?
Well,
it's full.
Yeah. If you have a low number of people riding it, and then you have a spike in ridership, it's going to be at capacity. But that doesn't mean, well, there are a number of problems with transit. One is we have to remember that the actual out-of-pocket cost of using transit is well below the actual cost of providing the service. Typically, we're only paying about 15 or 20%. So we have a fiscal problem with the way we fund transit, which is really a whole other topic altogether. But while even we're seeing the increase in ridership, again, it's sort of interesting. And I've looked at these numbers fairly carefully because the question is, are these permanent increases in ridership or not? We have we're still only seeing, despite spikes in gas prices to $4 per gallon, probably could have gone to $5 a gallon. We only saw a 10% increase in transit ridership. Now, when you're only at 10.7% of your travel already, and then you see a spike of 10% on the ridership, that's still a very small number. So the reason by the way, we talk about transit in the book, so we don't completely ignore it. The central point that I've come to believe is that transit's not a meaningful solution to regional congestion problems. The exceptions are. That's not to say that there aren't corridors that might not benefit from transit in particular areas. And actually, Seattle is better positioned to do that. But don't expect it to be a congestion relief strategy, because it won't work. I mean, just as the numbers. I mean, it's not ideological, it's numbers. But the two exceptions in the United States are New York City, which couldn't function without transit. I don't think there's anyone arguing that you take transit out of New York, that city's going to, well, Randall. But anyway, Randall. But I think, I mean, I still don't understand. I mean, the question is, for me, is why does New York Transit make money? And it could, but there are all sorts of reasons why it doesn't. The other is that transit seems to be effective along certain corridors in Chicago. But again, even in Chicago, it's not a solution to regional traffic problems. Now, when we're looking at Beijing, Shanghai, other places like that, a very different world altogether.
Thank you, Dr. Staley. He will be available after we wrap up here to sign books out of the display table we have out in the front. So if you're interested in his book, he'd be available to sign that for you.